Patients make their treatment choices based on emotion. A lot of doctors confuse that and think that if they present a lot of clinical information, if they display their credentials prominently, that that's going to really sway the patient. Some patients are analytical in that regard, and that will be a supporting documentation for why they move forward with you based on your credentials maybe. But 99% of the time, they're going to make the decision on moving forward with treatment based on emotion, whether they think that what you offer can actually improve their situation. So if a husband comes in and says, yeah, my wife wanted me to come in for this, I don't wear my CPAP and I snore and she's about to kick me out of the bedroom. You don't go into your clinical presentation at that point. You ask a pointed question at that emotional pain. Bob, that sounds really hard. Can you go into a little bit more detail on it? Like, has that been hard on the marriage? How long have you been dealing with that? And the knife gets turned a little more on that pain, and that increased pain makes them increase their level of wanting a solution for that pain. So understand, buyers, patients make decisions based on emotion.